Good afternoon, everybody. I'm just going to give it probably one more minute because I can see people coming in as I speak. So we'll allow another minute. Right, okay, I think we'll get started. I have a feeling I just said good morning before, and it's obviously afternoon, so sorry if I confused anybody. I am actually doing this from the UK. Welcome. It's lovely that we've got so many of you here, and I do expect a few more people to continue coming as we get started. Before we get started on the webinar, then I've got just one housekeeping slide, which essentially basically just says that we are recording this session and we will send you the recording afterwards. But we're also interested to hear your points and questions. So if you have any for us, please use the Q&A function to ask questions. And what we'll do is we'll reserve that to when we finish speaking. Okay, so my name is Maria Bryant. I'm a Professor of Public Health Nutrition at the University of York. And along with my colleague Dayna Brackley, we will be talking about some work that we've recently done together, landscaping the early years food provision. And this is a partnership between two programs, well, one program called FixOurFood and Bremner Co. And for those of you who are unfamiliar with FixOurFood, it's a food systems transformation project. It's funded by the UKRI and it is focused around Yorkshire. And Yorkshire is kind of an interesting area anyway. It's a geographically very large area. It is diverse, both in terms of its land, rural, urban and coastal, and also its populations. And we have fairly high levels of deprivation and very low levels of deprivation as well in the same area. And of course, it's an area where much of our food is also produced. So a really interesting case study area. And within FixOurFood, we are focused on a number of different systems, including hybrid business models, regenerative farming, and other kind of models that support that transformation. And the subsystem that we are really focused on within today, and the one that I lead, is focused on early years and school settings. So we're really thinking about sustainable, healthy food choices for children. And I guess what I wanted to do is sort of very quickly give you some insights as why we think this is important, particularly in the early years settings. And of course, diet and food has an impact on health and development at that stage. But it's also really important life in terms of part of life in terms of forming dietary preferences, forming eating behaviours, and potentially creating positive relationship with food. So it's a really crucial stage in our lives. And what we also know is that children in the UK don't meet our recommended intakes for food. Very few children eat enough fruit and vegetables, and this is unfortunately even worse in those living in a low-income family. And in Yorkshire in particular, we have poorer rates of diet-related diseases. So 22.5% of our children already have overweight or obesity by the time they start school, and 27% of them already have tooth decay around the same area at the same time. And of course, this is worse in those areas of high deprivation. And I guess what we would say is that although there's a long way to go in terms of schools, we know a lot more about what happens in that setting. And we understand the challenges that school settings face in terms of school food and school procurement. But we know really very little about the early years setting as a gap in understanding. And that's really why we decided to work on this project. And so we're working in partnership then with Bremner Co. And for those of you who are less familiar with this organisation, it's an independent consultancy really focused on food policy and practice. So what's going to happen today is I'm going to hand over to Dayna Brackley. Dayna is a partner in Bremner Co. She's going to talk through what we actually did, what we found, and then, as I said before, we should, fingers crossed, have plenty of opportunities for people to ask questions. So over to you, Dayna.
Thank you. I've set my timer to make sure we've got enough time for questions at the end. Thank you, Maria. I wanted to do a little bit of scene setting for early years nutrition and just to introduce EY as a shortened version, because I'll be saying it a lot today. So there are 140,000 children registered to attend childcare in Yorkshire. And just to put that in context, nationally, there's about 3/4 of children in some kind of childcare during term time. So it is a lot of children. And there's evidence to suggest that if a child ate all of their meals in that setting, that's estimated to be 90% of their calories for the day. And this is particularly important with upcoming childcare reform, whereby September in 2025, children from 9 months to 3 years will be eligible for 30 hours. And Nesta have predicted that there's going to be a 33% increase in the number of hours that a child is in childcare. The sector itself is often described as the Cinderella sector, and one that's under a triple threat crisis. So that crisis is to do with the pandemic, and then the cost of living crisis, and also a workforce crisis on top of that. And it's often in the shadow of school food. So there is some brilliant, fantastic advocacy forums for school food. There's quite a lot of strategic leads within local authorities or school food improvement managers. And whilst there does seem to be in the last year or so some more ramping up towards a focus on early years, it's definitely not there's not as much political focus. And I think some of that focus has come from, there was some research that indicated that 42% of people thought that childcare was a voting influence for them. And as you've seen, there's been more and more mention of early years politically. So the interesting thing about early years is it's a complex setting makeup. So there's 60% of children in Yorkshire are in a group-based provider, often discussed as a PVI, so a private or voluntary institution, and 28% in school-based and 12% in childminders. So not only are there different types of settings, there is also multiple types of provision. So some settings are packed lunch only, some settings are catered, some settings do no food at all. And then furthermore, in terms of the complexity of the makeup, you have still children in sessional care. So in Yorkshire, it's 62% are in full-time and 15% are in sessional care. So there's quite a lot of different areas going on here to manage, and it makes actually looking at this as a research project quite complicated. So you will all receive a copy of the report afterwards. So I'm not going to go too deep into the methodology, but I just wanted to give you a bit of background in terms of what we did. So we did a literature and policy review, and we mapped the EY sector in Yorkshire and looked at health outcome data. We then looked at menu analysis of 20 early years settings. But the main bulk of this research, I would say, is our qual research with 16 who I call system shapers in early years nutrition in Yorkshire. And that is local authority, different leads for different areas in local authority, the settings themselves across the different settings, procurement experts and caterers, and a government body. Just want to acknowledge here that I recognise that we don't have parents or children within this, but you will see as we go through that parents' views are shared through the lens of the settings themselves. So in terms of the aims, we wanted to look at the available data on child health in early years in Yorkshire and the policy and governance structures. I talked a little bit about that before, but all the settings characteristics as well on how they impact food provision and procurement. We wanted to look at monitoring and accountability. So how we were looking at the quality of food that was within settings, what EY policies there were, both wider early years policies and then early years nutrition policies, and then try and understand a bit more about the procurement and the supply chain. And throughout this, what I'm looking to do is identify the barriers to good nutrition in early years settings, but I also want to look at the enablers as well. So my 1 minute summary is it's very complicated. So you have this wider orange field, which is your wider children's health policy. So in that, I'm thinking of your healthy weight strategies, but also lack of data. Then you have early years policy. So thinking about that in terms of the early years foundation stage, free school meals, childcare policy. You then have early years nutrition policy, and I will touch a bit more on guidance later, but the different forms of guidance. You then have different approaches by local authorities, and that's to do with which of the settings are in their remit. So whether they have a PVI, private and voluntary institution, in their remit, or whether they don't. Then the settings themselves, and whether they offer food or whether they don't, whether they have a kitchen, whether they have staff. So what we identified was some consistent barriers to good nutrition and procurement of Yorkshire food in early years setting. I touched about this a bit earlier, but it was definitely lower on the agenda for school food, and this is particularly within local authority colleagues. What I want to say here is, though, there was a great deal of desire from the local authorities that we spoke to for this to be a priority, but they didn't have the infrastructure around them to support them in terms of funding and in terms of staff. And I think more widely, both government and also in the child health and food world, often we look at schools and onwards, and it's starting to change, but we need to be starting a lot earlier. There are stipulations with regards to free school meals for nursery children. I'm going to come into that in a bit more detail, but what this evidence shows is those stipulations are potentially widening inequalities and meaning that children are going hungry, and I want to touch on that in a bit more detail. But the workforce crisis itself means that staff are struggling to recruit actual staff to cook food, and the wider funding and workforce crisis is having an impact on nutrition. And I think that's the point that I really want to talk about today. It's how we make sure we focus on how these wider problems are actually affecting what's being eaten on the plate. And just to recognise that settings themselves have an incredible number of demands, did so before, even more so now with childcare reform. And focusing on nutrition is difficult, but the lack of desire is absolutely there, 100%. And what you'll see as we go through this research is insufficient funding will come up over and over again, but we have to think about that funding alongside the situation with food inflation, cost of living, and then operational barriers to getting nutritious food for state-maintained settings. So I'm going to briefly touch on the child health outcomes within Yorkshire. Then we're going to talk about the policy context, the makeup of settings, the different supply chains, and then I'm going to end with a part on menu analysis. So Maria touched on that in the beginning, but the tooth decay and obesity rates show a pressing need to address diets in the early years. So I want to spend a bit of time on this slide. You may have seen me, if you've seen me talk elsewhere, talk about this slide a lot. This is the difference between dental caries between age 3 and age 5. And I personally feel that people should be paying more attention to it because the jumps are quite stark. So if we looked at Corderdale, for example, 2.8 to 26.7%, Sheffield 0.9 to 41%. Now, obviously, children are eating food in lots of different locations, but as we've seen, if 75% of children are eating their food in childcare, I do feel that this will be contributing to that in some way. One of the problems with the early years is just there is a lack of data. So in terms of public health outcome data, what I would have to look at is the obesity data and the dental caries data, but there isn't much else for me to analyse. But actually, there are a lot of development checks that go on. So there's reception baseline checks, development checks, but they are not in the public health outcomes framework. So we really do have an evidence gap in this area. Now, looking at the policy context, one of the things that came out from the research is that early years is the first to go when we're talking about local authorities. So the priority is on school food. And I have this very good example from one of our stakeholders where when they needed efficiency savings, a finance manager came in and cut child food costs, but only the early years ones, not the school food ones. And I think that shows that it's lower on the agenda, but that is actually translating to poorer nutrition outcomes. Again, just want to reiterate that that wasn't from a lack of desire. They've spoken to some really enthusiastic local authority stakeholders within this research who really would like to see a change, but just don't have the support behind it. And part of that support is political support, both on a national level, but also on a local authority level. There's limited resources. And that goes down from limited resources from being able to work on all three of those setting types. So childminders, state maintained and private. So a lot of local authorities are just working on state maintained because private and childminders aren't in their remit. But then moving up, it's about there being not locally elected council members or council leaders who are banging the drum for early years. So it's an element of it being kind of out of scope. So I talked a bit earlier about the workforce crisis. So in Yorkshire specifically, there's the 7.5% decrease in the number of providers, but there's also an increase in the larger consolidation. We also analysed the childcare sufficiency assessments of North Yorkshire, Bradford and Doncaster. And all across those, there was mentions of labour crisis, staff crisis, and it was referred to as a recruitment and retention crisis. One of the impacts of this is the cook, the person that provides the food, is the first to go. So the actual funding is having an impact on the nutrition through staff not being available to cook the food. And furthermore to that, there is a lack of nutrition training for staff. Separate to this piece of work, I interviewed a nursery practitioner, level 3, who'd been working for 15 years in early years. And I asked her how much training she had had in nutrition in those 15 years. And she said in the 15 years, she had one PowerPoint slide within 1 hour of training, and she hadn't been offered any more. And part of that is because the funding isn't available for the training. But second to that, and very important, is the time is not available for the training because they cannot let staff leave to go and do nutrition training. So it's both a funding and a time situation. There's also quite a lot of pressure on the readiness and oral health. So getting children prepared for the next stage. So some local authorities are focused on this, some settings are focused on this, and at the detriment to nutrition. There's also quite a lot of focus on oral health. And this is something that Keir Starmer probably 3 or 4 months ago raised as an important point. And I'm not saying that oral health is not important at all. It absolutely is. And there is crises within that field also. But what it seems to be is there is a focus on post-eating hygiene and less of a focus about what's going in. And what the output of that for nursery managers is actually quite confusing. So they want to be focused on nutrition, but all of the information that they are receiving from government, from local authority, is about oral health. So I'm going to talk a little bit about access. So Maria talked at the beginning about the number of children under 16 living in poverty. And nursery free school meals operate under the same eligibility criteria as free school meals, but only 5% of Yorkshire children are registered as eligible for free school nursery meals. In comparison to the national figure is 8%. And what I do need to say with this is the data is incredibly patchy. So if I had a patchy data klaxon, I would be ringing it now. But there are certain eligibility criteria that impact access. The first one is free school meals are only available to children in state-maintained settings. Now, if we go back to that first slide, you would see that only 23% of children are in state-maintained settings. So it is very likely that there are children in other settings that would be eligible if it was just based on the benefit criteria, but they cannot get free school meals because of the setting choice. And just to say on that point, one of the local authorities we spoke to in Yorkshire said predominantly all of the settings in her local authority were private, which means that families who want to access childcare could only access private, which means that they would never be eligible for free school meals. The second criteria relates to, it's a stipulation that a child must attend before and after lunch in order to be eligible for free school meals. Now, this definitely would indicate to me that that this will have an impact on those living in disadvantage, because you would have to have the funding available for a child to attend that number of hours. Also, on top of that, not all nurseries are open before and after lunch. Some just offer sessional care. And that's contributing to a take-up rate of free school meals of only 55%. So I think it's definitely something that's coming through, and it's something that's also was talked to us about by the stakeholders, and that is that the settings themselves are feeding children who didn't meet the eligibility criteria. So the settings themselves are taking on the responsibility for feeding hungry children. What are children eating? It is the holy grail of questions that I'm constantly trying to find the answer to. We don't know very much is the honest answer. There's very little data on food quality in early years settings. There is some evidence to suggest that portion sizes are an issue, particularly in state-maintained schools. But in general, there is a lot of what this quote shows you. There is a lot of assumptions. We assume that nurseries are feeding their children relatively well. Maybe that's not an assumption we should be making. And following on from that, there's also an awful lot of guidance. So just to briefly touch on the guidance, you have the early years foundation stage, which talks about food being healthy and nutritious. You also then have public health guidance and associated menus, which were created in 2017, alongside the Eat Better, Start Better guidance, again created in 2017. And recently, a really good piece of work done by my colleague Sean Cowden at Leaf was to update the guidance to make it more accessible. And it's a really good piece of work, and I can share that afterwards. But that means that there's 4 different sets of guidance going on. So we asked the question within this research, do you follow the guidance? And the answer is many settings would like to, but they're just doing what they can. And this kind of chimes with research from the London School of Hygiene and Tropical Medicine, who were asking about guidance, and 82% of the settings they interviewed were aware of them, but only 48% were using settings, because their reasons were, we know what's healthy without them. But what it is sounding like from our research is the guidance is not fit for purpose at the moment. This is also the case with childminders. So again, unfortunately, very little research here, but some research done in 2016 said that food and childminders was not consistent with dietary guidelines, and the childminders themselves said that the early years guidance didn't hit the mark. So what's happening is a lot of the settings are deciding on their own principles for healthy food and nutrition. And I want to talk a little bit here about Ofsted. So when Ofsted go in, they can ask around food being healthy and nutritious. I have done quite a lot of work analysing Ofsted reports, and I haven't seen many that talk about anything to do with the quality. And this really interesting piece of quote came through from one of our stakeholders, that actually, because Ofsted are what they referred to as the arbiters of quality, the local authority themselves had stopped going into settings. So previously they used to go in, they used to have lunch, but the local authorities themselves were not seeing much evidence of quality of food within the reports that they were getting back. And what that means is they're not often stimulated to act, because they're not seeing anything that says, you know, the food needs improvement, because it's not being seen. What came through quite heavily in the research is the local authority involvement differs by setting. And I think we've got quite a few local authority colleagues on this, so I'm very interested to hear from you in the Q&A. But particularly, there is a lack of local authority involvement in private providers. And partly that's to do with remit and responsibility, and also a lack of kind of focus on childminders, again, because of remit and responsibility, and also a much more focus on schools and safeguarding. There was some evidence that local authorities were trying to change this, and separately in the policy review, we looked at North Yorkshire, not sure if you're on here also, but they had a skills mix team, and they actually worked with private providers, and they sent monthly messages. And I would say that is, when we're looking for enablers as we go through that, having some real dedicated resource within local authorities is 100% an enabler. There was quite a lot of feedback about accreditation. So many of the local authorities and the settings had considered accreditation or had gone down the accreditation route. But there was some quite interesting feedback around the accreditation itself not having enough gravitas, and that it was actually expensive and hard to do. So it seems like accreditation could be an enabler, but at the moment, particularly in Yorkshire, and particularly maybe because of the workforce crisis and the funding crisis that we've talked about, it's just very difficult for settings to do, but they would like to. I'm going to talk a little bit about how the makeup of settings impacts food provision. So this slide shows you just kind of how complicated it can be. So you've got 41% of state maintained schools the meals are provided by external providers, and that will be because it is linked into the school food system. And then you have childminders who are up there with 79% of providing the food themselves. And a childminder's experience of that will be very different because they're dealing with lots of different age groups as well. So that makes it slightly more complicated. You've also got multiple meals going on. So you've got lunch only, you've got snack, you've got tea time, you've got breakfasts. But one of the big things that came through as an enabler is when there is a chef employed by a setting, then locally sourcing food and focusing on quality was much more feasible. This quote on the right-hand side is from a nursery chef who was just so positive about working there, and the nursery manager was so positive about him working there, and just said, you know, before he came along, none of this was feasible. So I think it really shows how an enabler in this food system is having someone whose job it is to do that, albeit I appreciate that you require the funding to do that. And I just really want to reiterate that through everyone that we spoke to in Yorkshire, there's a real recognition that the food system in Yorkshire is fantastic, and that there is a lot on offer and there is a lot of opportunity. It's just there are lots of barriers in the way. So I'm going to talk about these 5, what I'm referring to as operational barriers. So funding and food costs, scalability, tendering, staffing, and child preferences. So the lack of funding and the cost of food is hampering progress. What I find quite interesting to see is there's quite a difference in funding depending on what setting you are in. So if you're in a private setting, it can be up to 5% of your costs. But then if you look down at a maintained nursery school, it's 1%. So within early years, there's no set per meal rate. So it's very different to school food. School food has a dedicated funding line that does not exist for early years. And what the researcher for the stakeholders told us is that cost is the greatest hurdle affecting quality and affecting locally sourced food. But again, what you'll see through it is there's a desire. So it's important to buy local. I think there's a will, but it's just around the affordability. But one thing I want to talk about is the one enabler that came through was there were some settings that had NGO support. And when they were able to do that, they were able to get some fantastic fruit and vegetables, really, really focus on quality. But they said that that just wasn't feasible if they didn't have NGO support. And I wanted to also say that there were a couple of organisations that we spoke to who got their food from food banks. And I've seen that increasingly in the wider work that I do on early years. So thinking about enablers as well as barriers, it seems that there is a possibility here that NGO support could help improve nutrition in early years settings. So how funding impacts provision. So what we were seeing is that because of a lack of funding, some settings are going to pack lunch. Now, I'm sure many of you will know the 1% figure, so 1% of school food packed lunches meet nutritional standards. I would really like to get to the point where I have a similar figure for early years. I don't at the moment. It's one of my pieces of data I would like to find. it's the rising cost of everything that's impacting settings. But one thing that did come through is that when a nursery is attached to a school, the provision is very similar. So they're operating under a school food system, and in that the policies are applying as well, so that some of that kind of school food standard work is moving. But one thing I would say is the very small amount of research that we have on early years, what it says is that portion sizes in this situation, when it is a state-maintained nursery attached to a school, are too large. And that kind of corresponds with the Science and Advisory Committee's evidence that suggests that portion sizes are too large. When a setting, particularly a smaller setting, is trying to use local Yorkshire supply chains, it was really hard for multiple reasons. So trying to go down the seasonal route, some of the people we interviewed just couldn't get a supplier to be interested because they were a smaller chain. The other issue that was coming out was that they were having to order from multiple different suppliers, and coming across like what was referred to as minimum order challenges. So particularly for smaller chains, it just wasn't feasible, and it became quite complex. And actually just going to the supermarket was a lot easier. I think one of the enablers here is we talked to some procurement experts. It's something like dynamic procurement, where actually a setting would be able to go on and pick from different suppliers and not have to do that manually themselves. So that could be something that we think about. But essentially what a lot of the settings are doing is online ordering and then having, topping up from a local shop. Focusing on caterers and local authorities, the catering manager that we spoke to, who had sites in Yorkshire, spoke about that they had got requests from nursery schools, so showing that will again to source from kind of local farm shops, but they weren't able to do that because their food was audited as part of local authority procurement rules. And the local authorities that we spoke to said there's a lot of interest, but there are procurement barriers. And the fact that there's no mandating of local food within council procurement contracts means there was kind of less impetus to prioritise it. And the local authority was reliant on whether there was the political will within the council to be getting local food on the agenda on the procurement tenders. So the desire is kind of being outshouted by the bureaucracy. So this particular technical officer talked about being limited by the Public Contracts Regulation of 2015. But I think one thing that came out as an enabler, always trying to pick these out, is around the local food strategies. So Yorkshire, everyone from Yorkshire who's on this call will probably agree, is really good at local food strategies. So I think, how can we work together to ensure that early years and procuring local food for early years is part of the local government food strategies that you're working on? The workforce crisis limits the ability for settings to focus on nutrition, and it's in general, there isn't enough money in the system is what we're being told, but there isn't enough money to pay for someone to cook. Now, the unintended consequence of this is that managers or members of staff are doing the cooking. There's a few things going on here. Firstly, there's, as this stakeholder said, everyone who is doing cooking should be qualified and trained to do so. But also what that is, you're taking away members of staff from elsewhere from what they should be doing. So you're actually impacting the wider quality of childcare as well as the nutrition as well. Now, this last section on here is about child and parents' preference. So one of the stakeholders we interviewed said that actually it's cost that was a focus for the parents and not around where the food was coming from. But secondly, that it was getting much more difficult to get children to eat the food that they were serving. Now, this might be a wider food systems issue in terms of child food preferences and bringing in, things around the baby food aisle and the impact of pouches and sweetened preference, and the lack of marketing restrictions and labelling. But there is definitely something going on here with with settings finding it more difficult to feed children nutritious food. And that's becoming quite hard for them to manage. My last point is a quirky framing one, and it's about what is local. So this was a really interesting finding from the research, is that what does local mean? And I think if we're going to be thinking about procurement and local supply chains, I think as collaborators, we need to think about how we talk about that, because what was coming through from the research is what is local. Is it okay if it's from North Yorkshire, or does it need to be a mile down the road from me? And what does local actually mean? So I don't have the answer, by the way, but I think it's something that we need to think about as we start working on early years and working on getting more Yorkshire food and Yorkshire carrots on children's plates. Is what does local mean to individual people, and how are we defining that in itself? I'm going to touch on the menu analysis now. So I want to start with saying there are a lot of limitations to menu analysis. Firstly, it depends on how often the setting themselves is updating it and what resource they have to do that. We don't know how regularly it's being updated or if it matches the food, but it is a useful addition, just an extra piece of data to this research that I thought I would share with you. There's a great deal of variations between the menus. You're not really seeing the same thing going across the kind of not particularly any threads. But an interesting thing when we're coming back to guidance is most of the nursery websites talk about being healthy, balanced and nutritious. So that is the exact wording that comes out of the early years foundation stage. There was no mention at all of eat better, start better, or the public health guidance. There was actually mention of other guidance, so the school food standards, NHS Start Well, which is a particular local authority, or just kind of more generic EY guidance. And I think that's interesting because I think the school food standards is quite well known, but that shows to me that the setting didn't think that was something that was relatively well known enough for a parent to consider it a selling point. There isn't a lot of mention of local food, so 20%, but there's no mention of anything to do with Yorkshire. And I guess that goes back to this framing point about what's important and how we sell the idea of local food and local provenance and the benefits of it. Most of the menu analysis indicated that it was an in-house chef that was cooking the food. There were very few policies, so no food policies. I saw one packed lunch policy, which talked about if a child sent a packed lunch to a setting that the setting considered didn't meet nutritional guidelines, they would send the packed lunch home and feed the children themselves. Yes, I've done that now. One thing that was really positive is there was a lot of evidence across all of the menus of the importance of fruit and vegetables. Fruit and vegetables were all over the menus every day, kind of mostly across every time that you could be feeding your children. The flip side to that was evidence of sugary desserts, puddings, chocolates across the menu rotations. So one setting offered Angel Delight, chocolate cupcakes and Rocky Roads as desserts for 3 days across a 2-week cycle. If we have any settings on here, I'd be very interested to hear kind of your thoughts on this, but it was also backed up by one of our stakeholders who said there's a bit too much cake and custard. How am I doing on time? I'm okay. Right. So I'm just going to summarize the barriers and enablers. So we've talked a lot about political will and school food across over early years food. And I guess what my encouraging thing would be is if you work in school food is to start to consider how you could start going backwards, because it's a really important time frame. And I think the political will kind of is ramping up for that. There are lots of other considerations for working in early years, and the main one of those is the incredible amount of pressure that settings are under at the moment from multiple different angles. So I think when we consider working with early years, we really need to bear that in mind and not be doing things to settings and including them with us. But also there's this procurement barrier within local authorities. Very keen on hearing from local authorities in the Q&A if any of that resonates. And actually it's tricky for the smaller settings to be trying to order food from the local area, just because they couldn't get people to deliver it to them. And I think what I'd really encourage is for looking at settings as a whole rather than split into childminders, PVIs and state if you're working at a local authority, because 75% nationally of the children are in the private and voluntary, and you've got 12% of children in Yorkshire that are in childminders, and when we just focus on the state maintained, we're missing all of these other children. There are evidence, well, there's absolutely evidence of some really passionate people, particularly within local authority, who want to make change in early years. So that definitely is an enabler, and actually making a lead within a local authority whose responsibility is for all of those settings would be fantastic. But the settings themselves need the funding to be able to dedicate resources to have a chef and to have some training. And third sector funding is a way of potentially trialing that and seeing whether third sector funding would increase the number of fruits and vegetables or improve the nutrition. And I do think that looking at the great Yorkshire food strategies and trying to put early years in there is a really wide opportunity that I think it would be a great idea to take hold of. So going back to the very beginning, so it's lower on the agenda than school food, and there is a lack of prioritisation. These stipulations are worrying because it means that there are potentially children who should be eligible who are not getting access to nursery free school meals, which is going to deepen inequalities. The workforce itself is struggling to recruit the staff in order to help deliver that nutritious food. And on top of that, not just deliver it, but to try and order it and to make use of the fantastic produce available within Yorkshire. It's difficult for them to focus on nutrition because there's so many competing demands. And the wider picture around funding and considering that funding alongside all of the other barriers of food inflation, cost of living, and operational barriers. So what shall we do together? So our calls are split into government and then research and then us as people that are looking to kind of collaborate together and do something different in early years. Starting with government, it's about political prioritisation. So early years falls under the Minister for Children and Families, and that covers inspection, regulation, literacy, numeracy, and free school meals, but not food. And food should be explicitly recognised, and that's what we would be calling for. And within that, why is it not in the government buying standards? It's a perfect opportunity to introduce it there. There also needs to be wider considerations about how you fund nutrition in early years settings. So answering that question as to why is there one funding line for school food, but there isn't for children in 0 to 5. And we need to focus on these stipulations to make sure that children that are eligible, particularly children living in disadvantage, have access to nursery free school meals if they need them. And I'd really like the drum to be beaten as loudly as it is for school food, free school meals around nursery children. The monitoring and accountability, we need to see more monitoring and accountability because the evidence that was presented back to me was that the local authorities are not really seeing anything within the reports. And that could be that Ofsted's role needs to change or it needs to be expanded, but there's definitely an opportunity there. And lastly, we need to make it a lot easier for settings to follow guidance. There should not be 4 sets of guidance going on simultaneously. There should be just a simple set of standards that people are able to follow, because it's quite hard to find the guidance. Some of it is kind of this thick long. We need to make it easier for them to do, to focus on good nutrition. And what about for us, for organisations advocating for improvement? So I would say tick box for today, because we're all here and that means we are improving collaboration against the sector. But thinking about how we engage policymakers, particularly in this very big year on early years nutrition, and how we work together to advocate for early years to be in those local authority strategies, those brilliant local authority strategies. And then lastly, we need to do a little bit of work when we're talking about this, about how we're talking about local food and sustainable food, to make sure that the messaging chimes with whichever audience we're talking to. I would like to see much more research. I'd like to see more research on the procurement, I'd like to see much more research around who's catering for who, and I'd like to know the baseline data for what the quality of food is, because at the moment we can't tell you that. And I'd like to look at more opportunities to trial different local procurement pilots, particularly within Yorkshire and with its settings, working with settings to understand what would help them to focus on nutrition and what would help them to improve nutrition in early years settings. And that is the end of my presentation. So I'm going to have a small bit of water and hand over to questions. But thank you very much for listening.
Brilliant. Thank you so much, Dayna. It's so much to take on, so much information there. Can I encourage people to put questions in? We've got some already in the Q&A, but please feel free. So I'm gonna start on some of the questions that are in there. I've got the first one from Barbara Crowther from the Children's Food Campaign. So I think you touched upon this a little bit after she put the question on, but she was interested in whether you picked up in differences in what settings we're able to do and the quality of food based on the levels of disadvantage in the area. And I was just wondering, in answering that, maybe you could talk a little bit more about what you said about how there's a potential to widen inequalities, perhaps beyond just the kind of free school meal entitlement or uptake.
Yeah, let me just read the question. So I wouldn't necessarily say that the research said, particularly in terms of the food quality, differed by different areas of disadvantage. So there was the stakeholder that told us that actually the parents' focus was on if they are having to pay for a nursery free school meal, for that for that nursery meal to be cost effective for them. And that meant, for example, the fact that it was local or organic was just not a focus for them. What the focus was can I afford it? I can bring in slightly some other work from here in terms of what's been happening in terms of disadvantage. There is a couple of anecdotes that were told to me recently about children being sent to settings with empty packed lunches in the hope that the settings would fill them. And then another who's the only setting available was a PVI private setting, and the child was eligible to get the 15 hours, but the parents were unable to send to the child because they couldn't afford the food. So those are the kind of insights I can kind of give you on that. But I think there needs to be wider research and wider data nationally, I think, around what's happening with families in disadvantage.
Yeah, great. And I mean, I guess across the board, isn't it? We don't really, like you say, we don't really know what the children are consuming in these settings. We have some indication from your analysis work of the menus, but we don't really have any good data on that. Thank you. There's a couple of other questions in here, I think probably coming at it from a parental perspective, but I guess I'd be interested to hear what you think about the role, if anything, we should be placing on parents. But Sundas Marji has asked about how parents, I'm assuming, might be able to approach those settings with any concerns, given that they tend to have closer relationships than perhaps they might do within a school setting.
Yeah, it's a very difficult one. I'm actually working on a research project this year where I'm trying to find out slightly more about the quality of food. And one of my big concerns is how, one of the things I want to look at is packed lunches, but one of my big concern is how you do that, like you say, without causing offence. How do you open up somebody's lunchbox and make calls on it without offending a parent? I think in terms of how can we address concerns over food without causing offence, I think it's a really difficult one. And there was this packed lunch policy, which I thought was relatively rigid, actually. If you sent in the packed lunch and it wasn't fit for purpose, it would be sent home. And there is a part of me that's like, great, strong policy, but then the part of me that says, do you know what, if that's all that person can afford to put in a lunchbox, then who are we to judge, really? I mean, I think it's a really difficult question. I think an enabler here would be for settings to have adequate nutrition training and then be able to share that nutrition training with parents through the communications that go on every day But at the moment, there isn't the time and there isn't the money. But had I, when I sent my children to nurseries, had they been talking to me or offering me, you know, information about healthy eating, I think that would have been a great opportunity to do that in that space. And I think that's probably the safest way to address concerns without causing offence, is to try and provide information, as opposed to ever kind of go down any way of judgment.
Yeah, and I suppose as well, it sort of opens up that conversation of where the enabler sits, at what level of responsibility is likely to have the biggest impact. And I guess a lot of the stuff that you have talked about already today is kind of top down, more kind of policy, providing more resources, etc., that enables and trickles down through that system, rather than focusing overly on the roles of individuals and parents.
I think, yeah, absolutely. I think I've seen that next question in terms of, this research wasn't on the kind of nutritional knowledge or culinary skills of parents, but what I would kind of draw your attention to is there is a very good piece of research by the Centre for Food Policy that's a longitudinal analysis that looked at parents' experiences of feeding. And one interesting piece of insight that came out of that was that the parents of children who had been to nursery all day were feeding their children less in the evening, and often opting for snacks that you would find in the baby food aisle, because they assume children to have been fed adequately during the day. And I guess my point is that we don't know that to be the case, because there isn't the monitoring and accountability, and there isn't the data. But as I said, as I said at the beginning, it didn't particularly focus on parents, although some information on parents came through from our stakeholders.
Yeah, and actually I guess there's a follow-up question to what you just said there, Dayna. Why is the data so patchy? I mean, I don't know if you're able to answer that, but what sense do you have?
My sense is because of the prioritization. I think that a lot of the focus is on school food, and I also work on school food, and that's been fantastic. But I think that's where a lot of the grant money has gone, and that's why there is a better bank of data. It's still not the best we could get to, but there's a better bank of data on school food. And I think there is an issue with the wider policy and advocacy piece on children's health, in that we don't consider children's health as a life course. So we are picking certain elements of it. And I know I'm part of that today because I'm talking about early years, but I work on breastfeeding all the way through to further education. So I work across the life course. But what we'll often see from different organisations is a focus on one particular part of an age group, or what we also see is a focus on children that includes mental health, physical health, and doesn't include nutrition. Yeah. So it's kind of, it makes no sense to me. I mean, both those things, both physical health and mental health, it's like, how can you miss this one? But that is going on. So it's kind of two things going on. So I think the more that we can think about children's health as a life course, and starting right back at the beginning, as a big kind of group of collaborators, I think that would be really good.
Yeah, absolutely. And those of us that have children or work with children or know children know that they change really quickly across the life course as well. So, you know, different solutions for different time points. So, yeah, really important. Okay, so a couple more questions. I've got one question that says, is it right that a lot of government engagement in early years nutrition seems to be with the Department of Health rather than the Department of Education? And is that a concern?
It's not necessarily a concern, but I think I think you could say the same of school food, really, like the number of different departments. So absolutely. So in terms of the people that I speak to across government, I speak to Department of Health, Department of Education, Ofsted. There's lots of different, and I actually think that's reflective of policy in general. I don't think that's a specific early years thing. I think it's our role as people that work in food policy to try and close that gap somewhat, and maybe this year is an opportunity to try and build those bridges and make sure that it's looked at through all of those different lenses. But I mean, as an example, I was looking at the school fruit and vegetable scheme today for another project, and there's 7 different government departments involved in that. So I don't think that's unique to early years. And I think, yes, I mean, there's a really good piece of work by Kelly Parsons on the different government departments that are involved in food policy, and it's actually 16 in total. So I think this is a wider food policy thing than necessarily an early years thing, but absolutely, I think it would be fantastic if we could all be at the table at the same time. That would be
absolutely
really great.
Yeah, absolutely. And we see that actually within local authorities as well as at a national level as well, you know, different areas of the local authorities dealing with similar things but not necessarily in the same way. So that would be great if we could help encourage people to talk to each other, wouldn't it?
Yeah, absolutely.
So we have a few more minutes left. There's a question in here from Nicola Nixon, and I was going to raise this, so I'm pleased that she's asked it. So many parallels with school food. Given the large amount of provision in the private sector, do you think there is confusion over whose responsibility quality of food is? So is it the provider, the local authority, or the parent?
Absolutely. There's 100% confusion over that. It's a really good question, Nicola. And I think the unusual thing with early years is, yes, everyone is in private providers, say 75% is in private providers. And therefore, what has been said to me in my years of working in early years is it's not right for us to get involved in that because it's private providers. But childcare policy is childcare policy wherever you are. It doesn't, you know, your eligible hours are for whichever place you're in. So why does childcare policy apply to everywhere, but nutrition policy does not? It definitely a lot of incoherence within that. I think it makes sense that if a local authority is responsible for the provision of food, then it's the local authority that is responsible for the quality of the food. And I think there's a lot of things that we could be learning from school food here, like the FSA compliance, and you know, this stuff is a lot further ahead. It would just be great if it can kind of move down. Obviously, if it's a packed lunch policy, then that would be the responsibility of the parent. But I think in obviously a kind and gentle way, you can set packed lunch policies to the best of your ability. Obviously, whether you reject packed lunches is, you know, quite a strict thing to do. But Nicola, I absolutely agree that there is confusion. My personal opinion is that confusion needs to be eradicated at the top, and there needs to be more clearer guidance about, firstly, clearer guidance, then clearer monitoring, accountability and responsibility.
Yeah, absolutely. There's a few more questions, and I've looked them together, and largely focus on, you know, what different sectors, what different roles can do to help here. So we've got, you know, what can parents do? What can the private sector do? What's the role of a dietitian? So how do you kind of bring all of those together, Dayna, in thinking about different people's roles in this system?
Yeah, it's a good question. I think, don't know that I necessarily know the answer to that one. I think what I would like to do is to bring all of those people together and to do more collaboration in this area. I think we've obviously worked on this really well together, Maria, but that's, you know, that's two of us. Mm-hmm. I'd like to see wider collaboration where we do more in-person understanding of what other people's roles could be. There was a really big piece of research that the Centre for Childhood, the Princess's charity, released recently about the role of business within childcare, which I was very, very excited about, but it didn't have anything on it in nutrition. And I guess there's that question around, you know, could it be something that supermarkets are involved in? But then I would go back to the question, why aren't we just establishing that it should be good food in the first place without having to get other people involved?
Yeah.
That may not mean that things progress. So absolutely, could it be that Sainsbury's or Tesco's deliver fruit and vegetable boxes to settings as part of a new scheme? I'd be 100% down for that. And if they could give us some money to evaluate it, that would be great too. But
lots of food for thought, Dayna. So we have run out of time. I'm sorry that we didn't get through all of the questions. A brilliant comment in there about free school meal entitlement, and of course we would all agree with that. So thank you. I want to say thank you again. It's been an absolute pleasure working with you. There is still much to do in this space, and I think this is just the start. And I guess I would encourage other people that are here with us today to get in contact if they're interested in thinking about the future of this area. We are going to send out a copy of the report. It has been embargoed up until now, but that should be heading your way if you're part of this session. But as I said again, do please get in touch, and very much want to push towards the advocacy for more research in this area to support the advocacy work. And I would encourage people to also visit our Fix Our Food website, where this report will be hosted, and lots of other interesting things that you might be interested in. So thank you very much, everybody. And we look forward to hearing from you.
Thanks very much.